another interview in my Austin Wellness series, and I'm very excited to welcome Sara Klopp here. Welcome. Thanks for joining me today.
Hi, thanks for having me.
So Sara is a PA and is doing some really amazing work in kind of the functional integrative medicine realms where there's a lot of work to be done. And specifically, she's been focusing a lot on thyroid and kind of hormone health. And for those people watching and listening, if you've had any issues with hormone dysregulation or thyroid dysregulation, it can be a really difficult field to get into. There's a lot of kind of ups and downs,
Yes.
literal ups and downs when dealing with this type of stuff, and it can cause some really funky symptoms. So I'm really glad that you're on with us today to kind of talk a little bit more about the details.
Yes, thanks.
And first off, I mean, I'm just interested to know, I'm always interested to know, how did you get into this specific track, so to speak, whether it's like the functional integrated medicine track or thyroid specific?
Right.
What led you here?
So I'm a PA, a physician assistant, and I've been practicing since 2004. And of course, like many providers, I was trained with the traditional medical model, which is here are the symptoms, name that disease, here's the medication that you prescribe. And so after several years of practicing, and I've worked in primary care, internal medicine, I worked in GI or gastroenterology for about 4 years as well. I just, you're helping people, but I felt like there's more. There's more I can do, maybe, through a different vehicle. And so I learned about the functional medicine approach and the integrative medicine model. I know some call it holistic or alternative medicine, but I know we're trying to get away from that word a little bit just because this really is complementary medicine. This is medicine that we can practice to get to the root cause of problems and truly help people. In my career, I had always counseled on healthy diet and exercise, and let's talk about your stress. Are you sleeping? But again, just felt like, and also I hate to say it, but kind of the insurance-based models, my time was limited. My patients that would come, unfortunately, many of them maybe weren't as motivated to be an active participant in their healthcare. So that's hard to fix people and help people if they, aren't really willing or able to do the work themselves. So yes, I learned more about functional medicine, integrative medicine, and wow, here is a field where I can have more time with my patients. I have all this time to gather a lot more history, hear their story. I mean, that's where you get these tidbits and these little nuggets of information where the light bulbs go off and you think, oh, it could be this or it could be that, or we should check this. So having that time with them, and then having patients that wanted to be, an active participant, make the changes, do the hard work. And then again, a model where the focus is the root cause. What's the root cause of the problem? So anything from like what you just mentioned, the thyroid, hormones, gut balance, the microbiome in the gut, talking about the immune system, inflammation of the body. We do have, obviously, have genetic predispositions for problems, but there's epigenetics, meaning the environment that triggers those problems. So we actually have a lot of control over these disease states. We don't necessarily have to just say, I've got 5 chronic diseases and I take 10 pills for them, right? What if somebody has underlying sleep apnea and no one's ever figured that out? Or they have post-traumatic stress disorder, which lives in your nervous system. And so until you do that kind of work, and like with you, acupuncture, right? Chinese herbs, I mean, these are all things we can use. And so anyway, going down that path, I always found endocrinology fascinating. It's complex, but also fascinating. And so kind of honed in on thyroid work and, talking about female hormones, even hormones like melatonin, right? Or the neurotransmitters in the brain that help with our mental health. Because I definitely think in the functional world, we all believe it's mind, body, spirit. It's all connected. You got to work on all of it. It's all connected. So yeah, I've really enjoyed, like I said, kind of getting down to that piece with the thyroid and the hormones. That's a long
Yeah.
answer to your
Yeah.
question.
No. I mean, I love it. It makes perfect sense to me, and it's just so. There's so many different thoughts going through my head when I think that there's so many practicing just medical professionals who, if they were just given a little bit more time, they could
Yes,
save so much
I
time.
know. It's huge.
It's like, let's invest a little bit of time and resources at the front end, and we can do so much for our patients in helping determine the root cause, so that we're not just focusing on symptoms. It's like
Right,
playing whack-a-mole with the symptoms, where if we could just take
right.
a little bit more time to look at that root cause, then poof, the symptoms just go
Exactly.
away.
I
But
know, exactly. It's
you're right,
huge.
it's hard. It's
It's
hard with
huge.
the insurance model.
And I explain it to patients too. You think of a tree, and so you've got the branches of the tree, and so those are all these disease states. And so again, when I worked more in kind of allopathic medicine, or just kind of that more traditional model, you're giving prescription medication, which, I'm not against prescription medication at all. I know it has its place, but also there are, side effects, and some prescriptions cause other problems that get diagnosed as some other disease. And it's like, no, it's the B12 deficiency from your metformin. I mean, you may not have, diabetic neuropathy. I mean, you could, but right. It's just, what if their B12 is bottomed out? And so that's why they're having numbness and tingling. So, you know, with this tree and these branches, you're giving all these different pills, when what if at that root cause, that root system is, again, underlying sleeping disorder, or they maybe they're on Synthroid for their thyroid, but they really need a medication with some T3 in it. Or again, let's talk about all the lifestyle stuff that will help your thyroid gland, the little gland that sits here, help it function better. So it will convert what's called T4 to T3, which is the active form of your thyroid hormone, which is actually what's going to make you feel better.
Yeah.
So even then, sometimes thyroid medication isn't, obviously the complete answer. It can help, and it can help when we change people maybe from Synthroid to something more like Armour thyroid, which is called like desiccated thyroid medication. Because again, it has the T3 in it. But yes, still you want to address kind of root cause as to why that person's thyroid gland is also not working well. And
Yeah.
that kind of goes back to, like, I'm sure you deal a lot with autoimmune disorders. So we do a lot of that in our practice. Is we're going to look again at the whole system. What's the immune system doing? What's the inflammatory state of the body? And again, that links back to foods and all kinds of things.
It's like it's all connected to
Toxins.
something.
Yeah, right. It's all connected. Imagine that. And that's what's kind of interesting too. With functional medicine, you could say, oh, it's progressive, but it's really, I don't know. I'm like, we're just getting back to basics.
Yeah.
Like, at what point did we get away from all these
Yeah.
basic things as the way to manage and treat patients, right? To talk about lifestyle, it needs to be more about wellness and preventative medicine. And I guess you could call it lifestyle medicine, but just that the choices that we make every day affect our health. And I don't mean to make it sound easy. I know it's hard, and I know
Right.
a lot of people have a lot of different, limiting factors, unfortunately. But if I can still be that guide, if I can still give them the education, give them the information, help them with some resources, help motivate them, understand, how XYZ will make them feel better, and they make that change, you might prevent diabetes in that patient, or heart disease. I
Right.
say you, I mean, the patient they do it themselves too. I mean, they're doing the work. I'm
Yeah.
just here to help guide them, right?
Yeah. Well, and that's why I love that we're kind of getting away from calling this alternative medicine, because there's like, why would this be the alternative? Why would
Right.
why would
Right.
everybody want this to be the more
Right.
conventional approach? But I think you're right. It's a big problem to try to undertake, mostly because of how insurance has set everything up. Um,
Right. Right.
but there are more and more medical professionals who are going this route, and more patients who are
Right.
demanding this. So it
Which
seems
is
like it's
great.
just a matter of time before insurance kind of,
Exactly. Gets
hopefully,
on board,
starts to
right?
analyze it and realize, like, oh, wait, this is actually going to save us a lot of money too. If we can be
Right.
more preventative.
Exactly. This is going to reduce cost because, again, if you can prevent these chronic diseases,
Yeah. Yeah.
or again, identify this, a root cause, what might be driving some of these
Right.
problems. Yeah,
Practitioners
for
will
sure.
be happier too because they'll be able to practice how they want to practice. I mean,
Right.
I don't think I've ever met a doctor who loves playing the insurance game.
No, seriously. I mean, again, we want time with patients.
Yeah.
We really want to help. But yes, when you have something else kind of dictating what you can prescribe, how much time you have with people, again, it's hard to really kind of bill for your time, get paid for your time, which again, it's sad. That's what we need with patients is we need time. And the patients need time with us. I mean, for us to, counsel them and then be able to ask questions. And like what we were saying earlier, really take a full history.
Hmm.
When you're listening to a patient, that's huge. You catch, like I said, you catch these little pieces of information that guide you. I mean, they guide you,
Yeah.
right?
Yeah. Totally. And with your expertise in kind of thyroid dysfunction and the nuance that comes with that, what can you tell to people who may think they might have some sort of thyroid dysfunction, or perhaps they're already diagnosed and they're on something, maybe they're on Synthroid. What sorts of symptoms should they be looking out for? Should it just be like, oh, I'm on Synthroid, I don't notice any difference, or I'm having these weird types of side effects? What would they notice where, somebody who's able to spend a little bit more time with them would be able
Right.
to help with?
So we have a lot of clients or patients that, they're actually on thyroid medication.
Yeah.
And the most common one usually is Synthroid. And Synthroid is only T4, which is the inactive form of our thyroid hormone. So your body needs to convert that free T4 to what's called free T3. Again, the active form where you actually feel better. So we actually will have patients that come in and they say, I'm seeing my provider and I'm telling him I'm still tired or I'm depressed or I'm gaining weight, can't lose weight, constipation, dry skin. I feel cold all the time. Or it could just be more of a sense of just, I just don't feel good.
Feel right.
I'm
Yeah.
lagging, I'm sluggish. I kind of have like this brain fog. And don't get me wrong, that doesn't mean it's all thyroid. I know those symptoms could be a lot of different, or from a lot of different things. But again, that's what I like about our practice is we're going to talk about all of it, not just the thyroid. But yes, one of the things we might find with thyroid specifically is, this person, well, and let me back up a little bit. So when they're seeing their regular provider, they might only be checking a TSH, which is thyroid stimulating hormone produced in the brain, and that's telling your thyroid gland what to do. The lab cutoff is this huge range. And sometimes when people are at kind of that very like borderline point, some practitioners are kind of doing checkbox medicine where they're like, oh, normal, 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 all your stuff is normal. And like B12 would be another example. It'll be called normal on the lab value, but really it's not optimal. It's at a level where patients are going to have symptoms. So we might catch those people that are being told your TSH is normal, but really it still needs to be optimized. It's still at a place where they're going to be symptomatic. And I mean, and that's in the literature, right? It just depends on what providers are maybe reading or paying attention to, or just updated guidelines. I mean, they've had articles come out recently saying, well, and this is my other point, that TSH isn't the best test. You have to be looking at that free T4, that free T3. We can look at something called reverse T3 to let us know how well you're converting the hormone. We always check, like we mentioned earlier, for Hashimoto's, which is a autoimmune thyroid disorder where your body's basically attacking the gland. The gland is inflamed. It's not working well. And then we go into all the ways we can help manage Hashimoto's. But yes, we're going to do a bigger panel of labs. And we can actually order this through your insurance company. So people can still utilize their insurance for the lab work that we're doing, which is great. But yeah, we're really teasing out how is the thyroid gland functioning? Is there an autoimmune inflammatory component? And then I'm going to talk all about your life, your lifestyle, your other hormones that affect thyroid, your adrenal glands, your blood sugar, your progesterone, your estrogen. I mean, all these things. But also too, we're going to talk about why maybe that Synthroid isn't working for you and why you might need a medication that's got some T3 in it. But also, again, ways in your life that you can be healthier where your body's going to do that conversion much more efficiently.
Yeah.
So yeah, that's kind of our bread and butter is broader range of labs, getting people to more optimal places. Again, thinking about that full big picture of what else could be contributing and considering, changing the medication to something that's going to work better, where they feel better. So yeah, back to your original question, definitely symptoms. People say I'm on medicine and I'm told my labs are normal, yet I still have all the thyroid, and I keep saying thyroid, hypothyroidism is what I'm talking about.
Yeah.
Low thyroid, hypothyroidism.
Yep.
So that's what we'll do, again, along with working on maybe their female hormones, because that's tied, and talking about cortisol and stress and our little adrenal glands, which are our stress glands. That has a lot to do with how our gland is functioning, and or a lot to do with autoimmune disease processes. So I mean, again, it's pretty cool how it's all connected. But also it means you're talking about a lot of things, right? That we can
Yeah,
work
but
on.
you're right. It's really cool when you know how to read those connections to benefit the patient. And I'm glad you mentioned the labs, because that's kind of a core component of functional medicine, right? It's not just
Yes.
relying on the lab says that I should be within this range. Like,
Right.
a functional medicine expert can look at like, okay, but you're at this level of the range
Right.
on like all of these components. Don't you think like if we could get you in the middle, you'd feel a lot better? And
Right.
that's
Right.
absolutely the case for a lot of things, not even just thyroid, but vitamin D, that
Exactly.
range is crazy big, where if people are at the lower end, they're gonna feel terrible.
Exactly. And you want to treat the patient, not the number. I mean, you want to get the numbers optimal, but again, yeah, you want to listen to your patient. If they're kind of borderline normal, yet they have all the symptoms, then again, you want to look into treatment, or you want to dig deeper. Or there's even something called subclinical hypothyroidism,
Mhm.
and that kind of loops back to where the labs look normal, maybe the TSH looks normal, but really the function is not good, and so you don't feel good. You
Yeah.
have the symptoms.
Yeah.
So
Yeah.
yeah,
I'm just so glad that this is becoming the new normal, because for
right.
so long there were so many people who were just suffering, but practitioners would just write them off because everything was normal.
I
And
know.
like, no, everything is not normal if they have all of these symptoms. We need to figure out what else is going on with these people. Like,
Exactly.
symptoms are something to pay attention to, and
Exactly.
patterns of symptoms are certainly something to pay attention to.
And like what we've said too, it's you can give medications to help symptoms, but if you're not addressing this, perhaps they do have underlying Hashimoto's thyroiditis, where they've got this autoimmune disease, like basically flaring, it's active,
Yeah.
yet maybe some practitioners are not checking those antibodies,
Yeah.
because we were taught in PA school, which basically we're trained like med students.
Yeah.
We were trained, oh yeah, there's this thing called Hashimoto's, and it's an autoimmune thyroid disease, and very commonly it leads to hypothyroidism, but you don't do anything differently.
Yeah.
You just give Synthroid, you just give medication. And again, if somebody has active Hashimoto's, they're probably not going to feel great, even on their treatment, and even if the numbers look good, because you need to calm down that inflammatory process. You need to calm down the immune system, and the reasons why it's probably flaring are going to be things that harm you in other ways too. So again, whether it's diet, gut health, hormone health, stress, sleep, nutritional deficiencies. I don't know if I said that, environmental toxins,
Yeah.
plastics and hormone disruptors. So again, you might be addressing kind of this bigger picture, but in that way, you're going to help optimize that person's health in general. and or help prevent them from developing potentially, metabolic disorders as far as, diabetes or dementia. Or again, maybe they've been suffering from anxiety and depression. They've been on all these antidepressants, anti-anxiety medications, but they actually needed someone to start really also looking at their hormone function and their thyroid function, their gut function, their nutrition. You know, those things will
Yeah.
help, and or if they're, disrupted, then it could be causing their problem.
Right. Right.
So yeah,
So I
again,
mean,
getting to
it
that
sounds
root
like
cause.
you're really working with folks on the whole suite of the human condition, basically.
Right,
It really,
right,
maybe it starts with thyroid for a lot of folks, but it sounds like it might also start with stress and anxiety and
exactly,
sleep issues. I
exactly,
mean, all of these are hormone related.
exactly.
So
Well, I think that's what I love about it, because I practiced family medicine for so long, and I loved, really getting to know the patients, being able to build a rapport with them, getting to know their families. And also it was just so interesting because we were treating everything. I mean, I was doing women's health, I was treating kids, talking about, I was, anxiety, depression, gut health. You're managing a little bit of everything. And with functional medicine, even though, like I'm sharing, I focus on thyroid and hormones, and I would say, kind of metabolic disorders, diabetes, things like that. But yes, it's all connected. So I still get to practice pretty much everything with my patients. Let's talk about, you know, the whole, again, mind, body, spirit. Let's kind of tease all this out. I still will refer them to their regular provider for like their routine cancer screenings and that kind of thing. Because obviously with kind of the model of our practice, we just don't have the manpower to kind of be their sole provider for everything.
yeah.
But still, I can help guide them along with their regular provider on ways we can help them feel better and, yeah, identify some potential root causes of their problems.
So for folks who may, maybe listening to this and say, that sounds amazing. I don't necessarily have thyroid dysfunction that I know of, or
Right.
I have stress because everybody does. But what can you suggest where we know how just essential prevention is? What can you suggest for folks who maybe think they are doing pretty good, like maybe they don't need to come in or take anything, but they really want to make sure that their thyroid stays healthy, that their hormones stay balanced? How does somebody do that?
So really, you mean just like recommendations,
Yeah, just
basically?
general. Yeah.
Yeah. I mean, it all starts with sleep, not to make it sound so simple, but I mean, sleep is huge. It's restorative. It helps us clean out toxins, helps with certain peptides that decrease inflammation. And so if we're not getting, I mean, everybody is going to be a little different, but I'd say 8.5 hours is kind of the magic number. I know that's not doable perhaps for some people, but at least 7 to 8 hours a night. And it needs to be restorative. So making sure there's not underlying sleep apnea or other, sleep issues, having what's called good sleep hygiene, having a routine, a dark room, kind of a cooler temperature in the room, not having pets and things that will disturb you. It just all comes down to adequate sleep. And then I'd say, I mean, gosh, there is a handful of kind of big ones. Stress. I mean, stress is, again, another root cause of anything and everything from,
Everything. Yeah.
you know, cancer to, depression, anxiety to, you name it. And that also links back to hormones, right? Well, and even sleep, when we talk about like the melatonin hormone and these kind of anti-inflammatory hormones. And then, stress is, of course, related with the cortisol hormone. Um, so stress reduction is huge. Again, easier said than done, but people need to have a practice of, well, like what you do, acupuncture can really help. Whether they're into, meditation or prayer, they talk about grounding and nature, getting outside, getting in the sunshine, um, taking your shoes and socks off and like feeling the earth, lay on the ground. Uh, they call it forest bathing, again, nature walks, all that is very soothing. Practicing mindfulness, yoga, deep breathing, that's going to help with what's called your vagus nerve. That taps into the relaxation part of your body. And again, that's with acupuncture, probably
Yeah,
similar
that's all
ideas,
that
right?
matters too. Yeah.
Yeah. And so stress, stress reduction, management of stress, take a look at your life. Are there toxic relationships? Are you in a toxic job situation? Are you doing too much? Make time for yourself. Um, and then diet is huge. Food is medicine. You have to eat healthy. Try and buy organic if you can, or what do they say? It's the clean 15 and the dirty dozen. You
Yep.
can Google that. So again, I know organic food is more expensive, but there are certain fruits and vegetables that are going to have a lot more pesticides, which is, again, you can read about how those are linked to all kinds of disease states. And then, yes, just trying to get your fresh fruits, vegetables, healthy fats, healthy proteins. Avoid the processed foods, sugars. So yeah, having good nutrition, because nutritional deficiencies is linked with all kinds of disease states, or if your gut is inflamed, if the bacteria kind of composition in your gut is off balance, it's called the microbiome. That's also linked to everything from, immune disorders, autoimmune disorders, mental disease, chronic pain, cancers. Again.
Yeah.
And then what else? So food, stress, sleep, again, kind of optimizing hormones. But if we're doing a lot of those other things correctly, usually your hormones can be fairly balanced, or can stay pretty good for a pretty long while. Now,
Yeah.
obviously there's age. We get older and
Nothing you can
things
say good about
change.
that.
I know. I wish we had the magic, pill or complementary medicine too.
Yep.
But actually, I say that. These things, they talk about kind of your biological health.
Yeah.
We have like a number for our health, but then more like internally with how you live your life, you might actually be younger than what your age is in numbers, versus you might be older than what your age is in numbers. So it does.
Absolutely. Depending on these lifestyle things that you're doing. I mean, like you
Right.
said, it's not, it's simple, but it's not easy. I mean, it's
Right.
it's a lot of
Right.
things to be trying to keep up with on a daily basis. Or certainly
Yes.
not saying that it's easy, but the
But
short
it's so
and long term
important.
benefits are just
And
astounding.
exercise. People need to be moving their bodies every day. Our brains, the way our brains work, it's to move your body. If
Yeah,
people
you're
are
right.
not exercising, really try and move most days of the week. It's
Yeah.
just, again, so vital for physical and mental health, hormone health. Again, all of it. Again, your sleep. If you're moving, you'll sleep better.
Yeah.
Um, yeah, so I kind of just the basic stuff,
Yeah.
right?
Yeah.
But when I work with people, that might be what we find. We might find that the balance of the gut is off, or again, we can tweak some hormones, we can tweak some nutritional deficiencies, we can, talk more about, some dietary changes, or with autoimmune disorders, you might find that there's certain food groups that your body is just not tolerating well, that can be inflammatory for you. So we can do a panel that can look for what's called an IgG antibody against those food groups. Again, it's not a perfect test, but it can help guide us to a certain degree. So, there's things like that we can do to help guide patients, help motivate them, and again, help make positive changes for their health.
Yeah.
So,
Yeah.
yeah.
Well, awesome. Well, thank you so much
Sure.
for all of those tips, as well as just the information on how you're approaching medicine, because I think it's just it's so needed. And
It
I'm
is.
so glad that people have access to this in Austin,
Yes.
and it's growing around the country, and it
I
fills my
love it.
heart. I'm so happy to see it.
I love it. I know. And it's great what you're doing too, because we recommend acupuncture often, and herbal medicine. this stuff dates back, I mean, this is, I think it's great to blend kind of the best of both worlds with
Yeah.
traditional medicine and more of the functional medicine model. So yeah, it's
Yeah.
good stuff for sure.
Yeah. There's definitely a place and a benefit for so many different types of medicine and approaches. So I'm
Yes.
glad that we're able to work together. And
Yes, me too.
um, so Sarah, how can people get in contact with you if they want to set up an appointment, or just see if they need to set up an appointment,
Yes.
whatever it may be?
So we're in kind of a process of a name change right now with our group. I work with Dr. Ron Manzanero, Manzanero, Dr. Ron Manzanero. So with the website, be drronmanzanero.com. So people can go to the website, and I've got my information on there, of course, as well, my bio, and how you can book an appointment. Goes over everything there as far as you know how long the appointments are and the pricing and everything. But like I said, we're able to run labs through insurance a lot of times, which is wonderful, and we're able to spend the time with you, which is so key. And I have a Facebook page. I'm not super tech savvy, but I've got a few things on there. So that's just Sara, Sara Klopp, Klop, P as in Paul, P as in Paul, PA-C. The C is, it just means I'm nationally board certified, but yeah, I'm a physician assistant, which is basically like a nurse practitioner. If people are familiar with PAs and NPs, and we basically do what doctors do. And so, yeah, that's how you can get a hold of me. And yeah, I'm just so thankful to have this career. I love helping people, and I love listening to your story and trying to get down to what's going on here, and let's work on it.
Yeah, well, that certainly shines through in just talking with you. So, thank
Great.
you again for doing what you do, and thank
Sure.
you for doing this interview. And
Yeah, thanks for having me. I really appreciate it.
yeah,
Definitely want people to know we're here to help.
good. My pleasure. And we'll talk soon.
Okay, thanks.